Lots of people don't know this, but it is possible to have sunburns even when you haven't used any whitening, organic or steroid infused products. Hi guys, so today we're going to be talking broadly on the subject of facial redness and the different things that could cause it. Now, after our last video on aloe vera and sunburns, we got 2 comments that brought our attention to the fact that we would need to expatiate on the subject of facial redness better. Now, the reason I put sunburns in air quotes is because it is not the best term to use to describe what this is. This is because this could be caused by a lot of issues, and we'll run through them in this video. Now, although a typical sunburn that is born from the actual sun could cause facial redness, there's still other factors that could lead to these things. The main reason why this video is important is because a lot of people have complained of this facial redness, and they haven't exactly used any steroid infused products or whitening or organic products. They just found out that they started having these things and they may not be sure of the cause of it. So I believe that as I run you through some of the reasons that could cause this, you should be able to pinpoint, and even if you can't pinpoint, it will be advisable to go see your dermatologist. Now let's kick off with the most popular reason why this facial redness could happen, and this is from use of corticosteroids for extended period of time. Now, if you are in the habit of using creams like this, or face creams that could contain or actually have been shown to contain high level of steroids, your skin may go through a stage called topical steroid withdrawal, otherwise known as red skin syndrome. Now, there is limited studies on the exact cause of this, but this typically happens when your skin sort of gets used to the steroid, and then when you stop it, or even while you're still using it, you begin to develop that irritation, redness, and itchiness around that area of your face. Now, in cases like this, it is advised that you stop using the product, or using the over-the-counter corticosteroid creams, and then just allow your face heal. You could infuse soothing agents into your routine to sort of repair your skin faster. Now, apart from steroids, there are other things that could cause that redness around your face, and one of them is barrier dysfunction. Now, if you over exfoliate or use a lot of harsh chemicals on your face, you could begin to develop signs of redness. Another reason is a thing called Demodex folliculorum. Now, a lot of people don't know this, but on your skin there are mites that live in your hair follicles. They're called Demodex. Basically, these Demodex mites feed on your dead skin cells and the excess oil on your skin, and then live in your hair follicles. Now, on their own, they're not necessarily harmful. It's when have like an influx of them, like people that have rosacea, that you begin to notice this redness. In cases like this, you could use salicylic acid or sulfur masks to sort of soothe that and reduce how much they are on your skin. Alternatively, you could visit your dermatologist or doctor to be prescribed oral ivermectin. Another thing that could cause skin redness is the medication that you take. Some antibiotics and oral contraceptives can cause you face redness. Another reason is atopy. So if you're predisposed to atopy, dermatitis, rosacea, those kinds of things, you would notice facial redness more often. Another thing that could cause facial redness is constant exposure to heat. We've seen this a lot in some of our clients that are chefs. We notice that they tend to have a lot of redness on their faces, and the best way to combat this is to reduce the exposure to the heat as much as possible, and also infuse soothing products into their routines. Another reason could be genetics. You could just be predisposed to having, red skin. Now, apart from genetics, we also have lupus. This is an immune disorder where your body gets confused, that is, your immune system gets confused and start to attack your organs. Now, your skin is also an organ, and you could develop something that is commonly referred to as the butterfly rash. Now, last but not the least, it could be linked to diabetes. So in this case, because of the excess blood sugar, it could lead to dilation of your blood vessels. For diabetic patients, it is referred to as rubiosis facie. For a more in-depth explanation of these issues, I'll refer you to this video that Dr. Dre made. She explained a lot of these things in better terms. If you have a predisposition to facial redness, one of the things that you need to avoid is alcohol. This is because when alcohol goes through metabolism in your system, it could provoke the release of histamines, which could lead to redness and rashes. So I do hope this video covers a lot of ground. So even if you haven't been using steroids and whitening creams and you develop those kinds of redness, please know that you're not alone. You should see your dermatologist so they can prescribe treatments for you. So I hope this helps, and I'll see you on the next one.